So Gunnar, you mentioned earlier briefly that sponsor oversight is a common cause of findings, or findings related to sponsor oversight is a common cause for findings in regulatory inspections. Could you elaborate a little bit on that?
Yes. In the normal circumstances today, it's quite common that the sponsor is delegating several tasks of conducting the clinical trials to a CRO or any other outsider. But the responsibility always lies with the sponsor. You can delegate anything except responsibility. And it's quite common, especially among the rather small companies, that we realize that the sponsor hasn't got a clue of what's going on. And they have no processes, no systems, and still they are responsible. And one of the things that the inspector is always looking for is what sort of contracts or communication plan do they have? How is the CRO communicating the findings or whatever they're doing? And what are the processes for escalating if a finding is occurring during the study? Incorrectly included patients or any other deviation from the protocol. And this is one of the things that it's very keen on making sure from on behalf of the regulatory agencies to realize that the responsibility lies with the sponsor, and therefore they must have a process to ensure that they get the information in a timely fashion, not 6 months later.
So it sounds like there are like practical processes that are not like rocket science or something like that you can put in place to make sure that you as a sponsor is informed?
It isn't rocket science, you're absolutely right. It's a very, very simple process that you make an agreement. You have a telephone conference once a week or once a month, and then you write if something occurs that deviates from the protocol, you should report it within 24 hours. It's just a general agreement, common sense. You don't have to make it more complicated than that. But it's not unusual that we find out that at the end of the study, 10% of the patient does not fulfill the inclusion and exclusion criteria, and still the sponsor has no idea about that one. And that's just not the way it should be.